Hey guys, my name is Ronald Solinto. I'm a registered nurse and also a family nurse practitioner. Welcome to my channel, Nurse Track 101, where nursing concepts are made easy just for you. Well, let's get started. Come on, guys.
Hello guys, welcome back to Nurse Track 101, and this is your host Ronald Solimto, and today we're going to talk about oral anti-diabetic medications, treatment options for hyperglycemia. I hope I can make this as painless as possible, and let's get started. So oral anti-diabetic medications. First of all, I want to tell you there are 8 of them, 8 classes, but I'm going to classify this, I'm going to categorize this into 5 classes based on their functions, their mode of action, oral anti-diabetic meds. The first one is one of the famous medication classes of medications. The function of this class of medications is to increase insulin secretion. So the first function is of the first class is to increase the insulin secretion. Like I know there's only 2 classes in this category, which is the first one is sulfonylureas, and which, for example, glipizide, glimepiride, and the second one is megalithinides, like such as Prandin. I'm going to talk about in detail in the next few slides on the specific medications, but for now, let's just talk about this based on its function. The second classes is the one that decrease hepatic glucose production and also increase insulin sensitivity. I know there are only 2 classes on this one, in this particular one, which is the biguanides, and such as metformin, and also thiazolidinediones, which is also called TZDs. The third class of medication, this is based on its function again. The third one would be on a function on the GI tract, this in the small intestine specifically. So basically, it's the function of this class is to delay GI absorption of glucose. And there's only one class for this function, which is alpha-glucosidase inhibitor, such as acarbose. The fourth function, or the fourth class based on its function, is its effect on the kidney. On the kidney, there's only one class of this drug. Function of this, the mechanism of action of this drug is to blocks the glucose reabsorption in the kidney. There's only one class for this, and which is SGLT2 inhibitors. And the last class based on its function, it's forgot to put the number here, 4, 3. The last one would be its effect based on the function. The mechanism of action for these drugs are to increase the insulin secretion, also decrease glucagon secretion, and delayed GI gastric emptying. And there are 2 classes for this. The first one is the DPP4 inhibitors, and also the second one would be the GLP-1 receptor agonist. So these are the 5 classes of drug based on this mechanism of action. Insulin secretion, increased insulin secretion. This one, decrease hepatic glucose production and increase insulin sensitivity in target cells. Third one, delayed gastric absorption of glucose, GI absorption of glucose. And the fourth one will be block glucose reabsorption in kidney. And the last one is this one, increase insulin secretion, decrease glucagon secretion, and delay GI emptying. I also have another way mnemonic for this that I will go over in the next slide. The mnemonic for this one will be mass GDB or BGD. You can do that too. So the first one is the mass would be, the M is megalithinite, and the A would be alpha-glucosidase inhibitor. First S will be the sulfonylureas. The next one will be thiazolidinediones. And the next S will be SGLT2 inhibitors. B will be biguanides, BG. This one would be GLP-1 agonists. And the D1 will be DPP-4 inhibitor. So based on, you can memorize this based on, you can use this mnemonic mass BGD, which is megalithins, alpha-glucosidase inhibitor, sulfonylureas, thiazolidinediones, SGLT2 inhibitors, biguanides, GLP-1 agonists, and DPP-4 inhibitors. So you can classify this based on the functions, or you can just use this mnemonic. Now I'm going to talk to you about the different kinds of this medications in details, and also I'm going to give you some nursing considerations. Okay, let's start with the first one, which is the megalithins. Okay, megalithins. This megalithins, the function of this, the mechanism of action of this one is increase insulin secretion. One example is, the brand name is Brandon, called repaglinide. So this is very glucose dependent, and the nursing consideration for this, one of the side effects, one of the most common side effects is hypoglycemic. So because insulin is produced, so this drug stimulates the insulin secretion. So insulin is produced, will lower the blood sugar of the patient. So for the nursing consideration for this one is, you have to teach your patient skip dose if you skip meals, because it's more dangerous for patients to have hypoglycemia. So if they don't eat, try to skip dose, but also it's not healthy to skip meals. And the second nursing consideration is this one should not be used with NPH insulin. It should not be used with the NPH insulin, because there's some cases there's a risk for angina, and so risk for angina, and also teach your patient to carry glucose, to carry like some hard candies or any glucose in their pocket. So carry glucose in case the patient has symptoms of hypoglycemia. So that's that for megalithins. The second one, it's alpha-glucosidase inhibitors. And for this one, it affects on the body is on the small intestine. So it delayed glucose. The mechanism of action is delayed glucose absorption in the small intestine. And as you guys know, if you have delayed glucose absorption in small intestine, so after meals you have decreased postprandial blood glucose. So you will have lower postprandial blood glucose. The nursing consideration for this drug is check for kidney function. So you have to evaluate kidney function before patients is started with this one. Check kidney function. It's not recommended for patients with renal dysfunctions. And also it's important to remind your provider to check also, I'm sure they should know, to check for hematocrit. This is part of the panel, CBC panel, and also check your hematocrit and AST level, which is aspartame transminase. This is liver function panel. Patients with this drug, on this drug, tend to decrease, there's a decrease in hematocrit and also increase in AST level. Expect that Some doctors will decrease the dosage for this one because it works on the GI tract. This one can cause GI upset like nausea. So expect that your provider will decrease the dosage for this particular drug because of its effect on the GI tract. Okay, that's the two classes right there. Now let's talk about the next one. Would be sulfonylureas. This also has similar function or mechanism of action as megalithinides, which is the increase insulin secretion. Also has function on increase the peripheral tissue sensitivity to insulin. As megalithinides, just like megalithinides, this one, patients on this drug tend to be hypoglycemic as one of the side effects. So you got to be careful. So nursing consideration for this one is be careful. There's a risk for hypoglycemia. So you want to tell your patients, hey, carry some glucose, some hard candies, or whatever that is that you can chew, or so it will help you if they have symptoms of hypoglycemia. Also, monitor CBC closely. So monitor CBC closely. There are some cases of patients have hemolytic anemia while on these drugs. You're going to be cautioned with patients with glucose 6-phosphate dehydrogenase deficiency. So in this patient, you got to be cautious. It can cause hemolytic anemia. But one of the most common side effect is hypoglycemia. So be careful with that. Okay. Number 4 is thiazolidinediones, TZDs, or some people call it glitazones. One of the example for this one is actose. I forgot to put one of the example of this one is glipizide, glimepiride. So this one is actose. I don't see this as common as it used to be because of some of the side effects and adverse effects. So mode of action for this one would be the increased sensitivity of insulin-dependent tissues, like skeletal muscle, like your muscles, or adipose, your fat tissue. Basically, increased sensitivity of insulin and decrease glucose output. So the mode of action, the mechanism of action is almost same as biguanides. Glucose output from liver. So nursing consideration for this drug is just be careful because this drug can cause fluid retention. It will worsen heart failure, make heart failure worse. So not recommended for symptomatic heart failure patient. Also not recommended for patients with history of bladder cancer. You have to monitor liver function because this drug is metabolized in the liver, extensively metabolized in the liver. And I want to tell this to female patients who are on oral contraceptions because they probably need to change. They probably need to change to other kinds of contraceptions because this one will decrease the effectiveness of oral contraception. I don't see this used as much because of this, especially this bladder cancer and the heart failure. As you know, patients with diabetic tend to have problem with hypertension that can lead to heart failure. I don't see this drug prescribed as much, but just good to know. Number 5 would be the SGLT2 inhibitors. So some examples of this drug is empagliflozin and canagliflozin. So anything that, if you see anything that ends with gliflozin, is this class of drug, is this class SGLT2 inhibitors. The mechanism of action is it works in the kidney. So if I want to draw for example, this is a nephron. This is as you guys know from your physiology and anatomy class, as you know, the blood goes through here. So in the nephron, if you see, this is the smallest functional unit of kidney, which is a nephron. This is the proximal loop of Henle and distal loop of Henle, and there's this co-transporters. This is in the proximal tubule area. There's a GSLT2 and GSLT1. So if your blood goes through here, most of the glucose, most of the sugar, most of the glucose in the nephron is reabsorbed. Most of them. 90% is reabsorbed by the co-transporter SGLT2, and 10% is reabsorbed by the SGLT1. So if you have SGLT2 inhibitors, that means it blocks this. So 90% of the sugar is not reabsorbed. This, as a result, you will have more sugar in the urine, and less sugar in blood. And the nursing consideration for this is actually a new class of drug. When I was in nursing school, this was not invented, was not approved yet. So I think the first drug was approved in 2014, if I'm not mistaken. So with this class of drug, you're gonna have, because they're gonna have more sugar, more glucose in urine, some patients, they'll have some genital mycotic infection, so fungal infection of the genital. So watch for this. Teach patients signs and symptoms of fungal infection in the genital, and report to the doctor if they have the symptoms. Also, since it works on the kidney, this is not recommended for CKD. So patients who have CKD, is not recommended to have this one. Based on the drug, there's a GFR value that you wanna pay attention to. For example, the empagliflozin, this one cannot be used. I think GFR less than GFR of 30. It's not like it's gonna cause the patient to have really bad side effects, but this drug is not gonna work for this patient because you need some perfusion here. Okay. The next one is there's a risk for dehydration for elderly people, especially those who are on diuretics. So this has to be talked with the doctor for patients who are on diuretics. And what you want to tell the patient, you have to increase their volume intake. They have to increase their water intake by 1-2 cups a day. So just watch for that one. And the next one is this drug rarely, very rare, can cause necrotizing fasciitis. This is a very, very nasty disease. It's very rare though, but it can cause in the perineum. It's between the genital and the rectum area. So it's a very nasty disease, although it's rare. But teach your patient if, for example, they have some kind of redness, pain in that area after they're taking this drug, there's a possibility they have necrotizing fasciitis of the perineum, or it's called also Fournier gangrene. So that's the SGLT2 inhibitors. Okay, let's go to the next one. Will be biguanides. Yeah, you've seen this a lot of times. Biguanides examples such as metformin or glucophage. There are other formin drug ending with formin in other countries, but they prove to be toxic. So that's why this is probably the only drug in this class, and it's very, very common. So the mode of action is like thiazolidinediones or TZDs. This is, although the exact mechanism of action is unknown, but this drug will decrease glucose production in the liver, and also will increase sensitivity to insulin in muscle and adipose tissue. Yeah, this drug, the nursing consideration for this one, it's this drug can cause a little bit of GI upset, so nausea, stuff like that. Some people have diarrhea, so teach patient that to take this drug with food. Some patients will like stop taking the drug, so just tell them take it with food if you have some GI upset. Also, during therapy, check the kidney function like BUN and creatinine, and during therapy, because this drug is known to cause, although it's rare, lactic acidosis. And it's not recommended for patients who have CKD. Patients who are in kidney dialysis, of course, this drug will not do anything and will cause lactic acidosis because there's no kidney function. But also patients who have CKD, you want to talk to the doctor and make sure that this drug will not cause significant worsens kidney problems. Also, this drug, as you know, if you want to take this it would take a patient for radiographic testing, like using iodinated contrast, you have to withhold this drug. Withhold this drug 48 hours before and after this, like MRI or CT scan with contrast. And lastly, since this drug can cause lactic acidosis, you want to teach the patient signs and symptoms of lactic acidosis, such as general malaise, drowsiness, hyperventilation, such as muscle pain, stuff like that. Hyperventilation and muscle pain. So teach them, let them know, like, although it's very rare, it still can happen, especially patients who have decreased kidney function. So tell the patients about this particular drug and make sure that teach them about the signs and symptoms for lactic acidosis. So that's that. Biguanides example, metformin, and we're gonna go for this. Next one will be second to last. This is the GLP-1 agonist receptor. This is pretty new actually. This drug was the first drug was invented in 2004. 4 or 5, and other brands that follow that they're approved like after 2010. So it's pretty new, and it's very, very good drug. The mode of action for this one, the mechanism of action is it acts as a agonist, if you know, in the GLP-1 receptor. I'm going to talk to you in detail on how this works. Yeah, so the mechanism of action for this drug it will act as an agonist in the GLP-1 receptor. For example, if you eat a meal, there's a receptor in your GI tract that will be stimulated, and the natural response of the body is to secrete a substance called incretin. And one of the incretin is GLP-1. So if GLP-1 goes to the pancreas, the receptors in the pancreas, it will produce these 3 responses. It will increase insulin synthesis. So you will have more insulin in the body, yes, and lower glucagon secretion. And also the effect on this one will delay or decrease gastric emptying. So you will still full. You will not have a rapid rise in blood sugar in your blood. So these three functions are really helpful after you eat something. And this is very glucose dependent. It depends on how much you eat, because insulin secretion is dependent on the glucose in your bloodstream. So that's the responses from natural response. And this drug, as a GLP-1 receptor agonist, it will work. It will enhance the function of this. Yeah, as you know, an agonist is a chemical that binds to a receptor and produces and tells that receptor to produce a biological response. So with GLP-1 receptor agonist, there's going to be more GLP-1 available, and in turn it will stimulate the receptors to produce all these responses. Okay, yeah, some example of this drug. Some example is this drug is dulaglutide, or also known as Trulicity, liraglutide. So anything that you see this glutide, this ending, this refers to this drug. And the nursing consideration for this, it's a little bit, this drug has some warnings. If you have a personal or family history of medullary thyroid cancer, or if you have a history or patients with multiple endocrine neoplasia syndrome, or MEN2 syndrome, this is contraindicated in these patients. So if you have somebody with thyroid problems, somebody with dysphagia, somebody with they found a new mass in the neck after they used this drug, be very cautious. So you want to counsel patients regarding the symptoms of medullary thyroid cancer. Also, this drug can cause acute, there's some report of acute and chronic renal failure with this drug, and you want to check for, the provider is going to check for, of course, as you know, BUN, creatinine, GFR. And some patients also teach them about hypersensitivity reaction. Some patients have hypersensitivity or allergic reaction to this drug. And since this drug works also on the pancreas, because it will stimulate insulin, watch for signs and symptoms of pancreatitis, such as severe and persistent abdominal pain radiating to the back, nausea, vomiting. You want to check for this one. Make sure teach the patient about the signs and symptoms of pancreatitis. Okay, that's GLP-1 agonist receptor. Now let's go for the last one. This is called DPP-4 inhibitors, dipeptidyl peptidase inhibitors. For example, sitagliptin, known as Januvia. There's also linagliptin, known as Tradjenta as the brand name. If you see this ending, yeah, this is the class of drug, DPP-4 inhibitors. This is related to GLP-1 agonists in the mechanism of action. As you see before that I explained earlier, if you eat any meals, the natural body response is to secrete, because of the rise in blood sugar, the incretin hormones. So the body will secrete incretin hormones because there's a cells in the stomach that is stimulated by that. And one of these chemicals is called GLP-1, the one that I described earlier, GLP-1 agonist. So the natural body response is to secrete this hormone, and it will produce a response, which is the increased insulin secretion, decrease glucagon secretion, and also delayed gastric emptying. But somehow there's a chemical called DPP-4 enzyme that will inactivates this GLP-1. So if you have DPP4 enzyme that will inactivate GLP-1, you take this drug. This is called DPP4 inhibitor. It will inactivate this one, DPP4 inhibitors. So if DPP4 inhibits DPP4 enzymes, as a result, you will have more GLP-1. So that's how the mechanism of action for this drug. The nursing consideration for this one is almost actually the same as the previous one. Monitor for signs of pancreatitis. Signs and symptoms of pancreatitis, because as you have more GLP-1, there's going to be more GLP-1 receptor on the pancreas that will be stimulated. So monitor for signs of pancreatitis, such as persistent or severe abdominal pain, that radiating to the back, nausea, vomiting, symptoms like that. Also, assess for rash, because this drug can cause Stevens-Johnson syndrome. This is not just typical rash. If you have severe and persistent rash, and especially if it's accompanied by fever, general malaise, fatigue, conjunctivitis, and oral lesion, this can be fatal and could be a Stevens-Johnson syndrome. So you got to be careful with that. Teach your patients about the signs and symptoms. Yeah, that's my lecture. That's my video on the oral anti-diabetic agents.
Thank you guys for watching. I hope you enjoyed the video. And I also hope that this video will help you in your studies to pursue a career in nursing. If you guys have a request about any other topics, leave a comment below. If you guys like, share, or subscribe to my channel, it will help me tremendously to make more of these videos. See you guys next time. Bye.